Hello, I'm Dr. Williams. I believe you're here for a consultation.
Yes, I've been trying to lose weight and it just seems impossible. I've tried exercising and eating better and I haven't seen a change. I just want to lose this weight.
Well, I looked at your records and your calculated BMI. Your BMI is currently 42, and you've been trying to lose weight for quite a few years. Is that right?
Yes, that's right. I just don't understand why I can't lose the weight.
Well, you just might qualify for bariatric surgery. I would recommend that we give it some thought because your blood pressure is very high, as well as your cholesterol levels. I saw in your records that you were diagnosed with type 2 diabetes last year. Is that correct?
Yes, my last doctor diagnosed me. I brought up the subject of surgery with him and he told me that it was the easy way out and that it was too risky. He told me to use the proper way to lose weight. I'd been doing diet and exercise for almost a year at that point, and it just didn't seem to be working. I was frustrated, and that is why I'm now in your office instead of his.
It is a shame when a health professional doesn't understand or empathize his or her patient, isn't it? I've looked over your records, and I know you've been struggling. I'm going to bring in my good friend and surgeon, Dr. Hudson, to discuss some of the surgical options with you.
Sounds good to me.
Hello there, nice to meet you. My name is Dr. Hudson. Let me give you a brief explanation of some surgical options. There are a few types of surgery that I would suggest. They're all gastric bypass surgeries and it will either involve restricting nutrients in food or preventing absorption of nutrients in food. The first one's called Roux-en-Y. I would highly recommend this one because the recovery time is rapid and this procedure can be done laparoscopically. We would staple your stomach and create a Y-shaped section of the small intestine to connect it to. The second one's called biliopancreatic diversion, and this is much more complex. The lower half of the stomach would be taken out and the top half would be connected to the small intestine. This procedure is a lot more risky. Another option would be an adjustable gastric band, which is basically a band that goes around the stomach and creates a feeling of being full. Any of the surgeries will involve many challenges. After the surgery, you will not be able to eat for a few days and then have to start on a clear liquid diet and a slow transition through liquids to soft foods for many weeks. In the end, however, the benefit will outweigh the negatives in the procedure that we decide to use.
That sure is a lot to think about. One of my friends has had gastric bypass surgery. I would like to talk with her before I make any decisions.
That would be a wise decision. If you have any questions, feel free to contact me or Dr. Williams at any time.
Thank you. Hey Carol, thanks for meeting with me.
I'm glad I can help you make an important decision. What questions do you have for me?
Were you afraid to have the surgery?
Yes, I felt ashamed of myself because I felt like I had given up on the right way to lose weight. I didn't want to discuss it, even with my doctor, and I was worried that my doctor would call me lazy or chastise me about giving up on my workout and diet plan. Ultimately, I decided that I had to do what was best for me, and I'm really glad that I did.
Did you tell anyone about the surgery besides me?
I only told my parents and one of my good friends from high school because I really didn't want people to look at me differently. Then one day, someone in the office asked me if I had bariatric surgery. I told them the truth and they were surprisingly kind. They told me that they had a friend who was considering getting the surgery as well. It felt really good to finally talk about it. I was so worried that someone would make a rude comment or judge me, but then I realized it doesn't matter what anyone thinks as long as I am healthy and happy.
That is so true. When you told me, I was happy for you. What is life like for you now?
Well, I watch what I eat every day. I have to eat healthy and exercise or the surgery will go to waste. I also have to take supplements because my body has a very hard time absorbing the nutrients that I need. Your doctor will talk with you about all of that. You just need to think long and hard because this surgery is not a forever fix if you don't dedicate yourself. You must eat healthy and exercise.
I know that I will eat right and exercise. I really want this surgery. Thank you for talking to me about this.
No problem.
It's good to see you, Dr. Williams.
It's good to see you as well. You look fantastic. How do you feel?
I've never felt better. The first few months were challenging. I'm sure you remember when I came here with gallstones.
Yes, I remember. That seems to occur sometimes with the rapid weight loss. Any other problems?
Well, I'm thinking of getting some of the excess skin removed, but on a positive note, my cholesterol and blood pressure is in check.
I'm sure that feels fantastic. I think you made the right choice. Try not to be ashamed, although I know it is hard when you fear being judged. Just remember that your health is the number one most important thing. I'm going to get you out of here now and enjoy the sunshine. Have a great day.
Thank you.